Good morning, my beautiful people out there. And we hope that you enjoyed that segment just now with Mr. Brad Patico. I felt like we were in a musical, and a beautiful Village Brand musical at that. I mean, his music is always amazing. But now we're jumping into our second segment for today, and we're talking about Suicide Prevention Day, which is September 10th. Here joined with us on the couch this morning is Dr. Alejandro Matus, who's a psychiatrist, as well as nurse Mirtha Ical. So good morning to both of you.
Morning.
How are you both doing this morning?
We're doing fine this morning.
All right, so this is a very, very important topic that we need to discuss. It's still taboo out there for some people, but it is something that needs to be discussed. So let's talk about the Suicide Prevention Day. Why celebrate this?
It's more of celebration, it's a commemoration. It's putting aware of the population about the importance to know this problem. Yeah. It's a problem that's affecting the population in all the world. And then the World Health Organization created that day, the 10th of September, to make conscious to the people that this problem. And this year is the motto this year is creating hope through action. And then the Ministry of Health is trying to do a lot of action to put access to the population, to the health service, to prevent and to treat this problem.
I love it. I want to ask Nurse Ical, tell me something. Do you think, in your profession, you're meeting so many different people, do you think people look at suicide as something that we haven't believed? Because, when you have maybe a news article, it's rarely highlighted to as well, unless it's underneath certain circumstances that somebody died by suicide. So do you think it's something that people even see as an issue in belief?
So presently, I would say that they have a misconception about it. It's still a myth, it's still a taboo. But again, that is the reason that we are celebrating this week. We are putting awareness, we are reinforcing awareness about this special day that's coming up. And we want to make sure that the general public understand that it is real. Suicide is real. It's occurring. And if you can see it's occurring to every single time, but we are not seeing it as frequent. But it is real. It's happening more often than we can imagine.
Definitely.
So, just a quick question here. Is there any way that somebody could go and educate themselves about maybe some of the signs or what to look out for?
The danger signs for most of all would be like the signs of depression, the hopelessness, the worthlessness, the feeling, the withdrawing of the society, keeping to yourself, not eating well. So giving away their possession would be one of the danger signs. Something that they really value would be, it's something of assets for you to be giving it away to your family, your friends. Also, one would be clearly, bluntly saying, I want to die. Remarks about them saying, I will do this. But that is where we, as the family, as the friends, as the professionals, we need to take those comments seriously. And that's where we are missing. We need to take it seriously so that we can do something. And that is where our team comes through action. We have to do it in action. We have to show them the support.
And so with that action, so what are the activities people can look forward to? They need to make sure they turn out, because I know we were talking off break about some great fairs. So the information that Nurse Ical is talking about, that's going to be given to you.
Yes,
fairs. But
yes.
Tell us more what you guys have planned.
Every single district have their own activities for this week.
Okay.
But our activity here in Belize would be, we are attending health fairs, we're doing our presentation at our different schools.
Okay.
We have today, this morning, we are doing our session with you all. We are out in our clinics doing our sessions. So it's a full week that we have. And then Friday, we are looking forward for Friday, which would be our raising of our flag.
Nice.
That would be at Cleopatra Polyclinic. So we have our activities set up. And we are looking forward that the public do look out for it. And I'm glad yesterday I did my presentation at Metron Roberts and it was successful.
Great.
I had so much participants. They were asking. They were readily accepting the information.
I think it's something that needs to be
Yeah.
put out there as well. It's not a myth, people. It's not
Exactly.
it's not taboo. It is something that's happening in our country. It is something that's happening all over the world. And the better we educate ourselves about it, the more we can prevent
Definitely.
it.
And I
Yes.
just want to bring Dr. Matus in on this conversation because I know, for you, when it comes to parents, it's something very important that they should be having conversations with their children. Could you guys advise us, what are the ages that maybe parents could talk to their children when it comes to suicide or maybe pay attention? Because I know Nurse Ical was talking about, the comments of I want to kill myself or so. Like, how can we address these things?
Yeah, we need to remember that this is a problem multifactorial.
Yeah.
The mental health is important, it's a key to understand this problem. Then the economic situation of the family, then the academic situation of the young children, because it's important to know that most of the attempt of suicide is between the 15 and 29 years.
Yeah.
This is the higher rate of attempt of suicide. And we need to focus in that population. Then we are open, the Ministry of Health is offering a lot of attention. We are offering in every district, psychologists, counselors, psychiatrists, psychiatric nurse, open every single day of the week to receiving the call of the parents, and we are giving orientation to school. We are giving orientation to focus in a specific population. What to do with the parents? They need to speak frankly with the young since the 12 or 13 years because it's an age that can be a risk, and they can open approach about that. They need to talk openly about that. They need to feel how it's doing the children at school. They need to ask about how they feel in the mood. They need to know how to approach these young people, and usually it's frankly open. And
Don't beat around the bush.
exactly.
Okay.
Okay.
Because that would have been my next question as well. Let's say you're in that situation now where, let's say a younger sibling of yours comes to you and tells you, or you discover something through their phones or something like that. How do you attack or how do you approach that situation there? Is there anyone that we could call? Or we just have to deal with it personally like that?
First of all, you provide reassurance.
Okay.
You reassure the person, it's okay, I'm here. Make yourself available for him. And possibility, if you can, knowing that today we are here talking about it, you can inform them of our different services that we offer at our different clinics. So that's how you would approach it. But make sure that you reassure him. Do not provide no negative thoughts.
Yeah. Don't shove it aside. And also,
Yeah.
I know Dr. Matus was talking about how, across the country, there are access to services that you
They
can
are.
go in. You can do
Exactly.
group sessions too as well. Because
Exactly.
maybe parents don't know how to deal with it. And that's okay because we're human. We don't have
Yeah.
all the answers. So let's go to the professionals and say, my child has said X, Y, and Z. Let's dive in deeper. And then, of course, we have somebody that's going to be like a mediator, that's going to be guiding that conversation to help us get answers to as well, because you can't do it by yourself. I'm sure the services are free too as well.
Absolutely.
And they
Free,
will be
yes.
able to access it. And let's make it happen, guys. Let's not shy away from conversations. Let's be point blank and frank and address it before it's too late.
Yeah. I think that it's important that the population is losing the fear for mental health.
Yes.
Mental health is not only crazy people. Mental health, all the people that have a brain can have a mental problem. It's only, we are open to offer all the clinical attention.
Yeah.
It's free. We have the best advice possible. We have this counselor. And if the patient needs medication, the medication is free. It's a medication like the same medication that USA or United Kingdom can give for this problem. Then only they need to reach the clinic. We are working every single day, and we are open to give the consultation to the population.
Is there a chance where somebody wants to come to the clinic, but maybe they have different working hours? Can they maybe try talk and see, can we please arrange for a specific schedule or maybe a specific time or so? Because Like, they can't do a specific time that we're having.
Yeah, absolutely. Yeah, we
We
are open.
accommodate.
Okay.
Yes.
Yeah,
Perfect.
8
So-
to 5 o'clock. 8 to
8 to 5.
And then
So let's say
you
if
can
someone works up to 8 to 3 p.m., we accommodate them in the evening. So like 3,
And for
4.
people who work 8 to 5,
For 8 to 5,
Usually,
any time?
I'm attending patient at 12 o'clock at the time of
during lunch.
and then I'm scheduling some patient.
okay.
Okay,
All right,
perfect.
great.
So they'll work with your schedule so you can be able to access the services, but don't suffer alone. Don't leave conversations unturned, and let's try our best because, like you've mentioned, the day is commemorating us to highlight the information
Exactly.
available, highlight the resources available, and highlight us that this is a problem that's happening. But I just want to thank you guys so much for doing this great work.
and beside all of the services that Dr. Matus have highlighted, we also have our social worker. So for any social issues,
Perfect.
don't
Okay, great.
hesitate. We're open.
Go
They
in
can
and ask.
come.
Ask the questions, talk, and I'm sure they can always check out the Facebook pages and be able to message in and say, this is the problem. How can we fix it? Where am I supposed to go? And that in itself can lure you to where you need to be.
Yeah.
But we just want to thank you so much
Yes,
for not
thank you very
forgetting.
much.
Because like I mentioned in the commercial break that a lot of times with a September celebration, we forget this needed
Yes,
conversation.
it always
This day to
overcomes the
highlight that it's suicide prevention and we need to prevent it because as much as we think it's taboo, it is prevalent. It's here in our country. Men actually are more subjected to it than
Exactly.
females, and we need to do something about it because mental health is everybody's business.
Yes.
And we are here to break that taboo.
We're
Great.
going to break it, and thank you so much for the great
Thank
work.
you, thank
Please
you.
access the services, guys, the medication. Every single thing is free. They're going to work with your schedule. Do not shy away from it. Don't make an excuse. Get the help you need for your health. So I just want to thank you guys so much for this, and check out the Facebook page, guys. So with that, we're going to go to our next commercial break, and when we are back, Brandon, I get excited.
Leave people business alone, Renata.
Oh, Lord, have mercy, guys. We're having Christopher Martin is here. He is waiting patiently to be able to grace us with his presence and have an exciting conversation about what he's doing, what's his music about, and you guys can get your chance to ask your questions too. We're going to try our best to address it. But let's have a good time, man. Let's do this. So let's get a commercial break and we'll be right back.